Ebola virus disease. EVD is a viral disease that is also extremely infectious and can spread very quickly within communities. It was first found in the Pteropodidae family of bats, as well as in chimpanzees. However, the first human diagnosis of this disease was first made in 1976 in the Democratic Republic of Congo. It can only spread after an infected animal or human presents with symptoms. And the way it spreads between animals to humans includes killing and eating infected animals or through waste products such as urine and feces. The way it spreads between humans and humans is through blood and body fluids, bedding and clothing, and needles. Even caring for sick relatives or touching deceased relatives can also spread the disease. The symptoms for this disease come in stages. The first stage is early symptoms, which is the first 5 to 10 days of having EVD, and these include fever, severe headaches, muscle aches, chills, and weakness. The next stage is later symptoms, which is after the first 5 to 10 days of having Ebola, and these include nausea and vomiting, diarrhea, red eyes, raised rashes, severe weight loss, bruising, and bleeding. The next stage is final symptoms. This is right before you die, and these are multiple organ failure, jaundice, which is when the skin turns yellow, delirium, and seizures. The viral pathogens of EVD break through the skin and into the bloodstream. This causes issues in the cardiovascular and respiratory system. EVD influences the adaptive immune response and sometimes even paralyzes the immune system completely. Ways to prevent Ebola from spreading include avoiding areas that have known outbreaks, washing your hands frequently. In developing countries, avoid buying or eating wild animals. Avoid contact with infected people or animals. Don't handle remains of infected animals or people. And get the vaccine. However, new and more efficient vaccines are still being developed today. Since there is no cure for EVD, we can only treat the symptoms. This means extra oxygen for when patients are short of breath, pain medication for muscle aches and headaches, and anti-inflammatories for fever and swelling. However, Inmazeb and Ibanga are two medications that were both approved in 2020. Since they've been put in use, death rates have decreased massively, and patients with Ebola have an increased chance of survival. When it comes to diagnosing patients with EVD, when showing symptoms of Ebola and the patient has been in known contact with another infected person, the patient is isolated and blood samples are collected. These blood samples are then sent to a science lab and are tested using a method known as polymerase chain reaction, or PCR. This is the most common diagnostic method used to identify EVD because it is able to identify the smallest amounts of EVD in the infected organism's serum, blood, or plasma. Another way to test for EVD is using antigen capture. Antigen capture could also be used and is a much more rapid procedure and informs doctors quickly about a patient's diagnosis of EVD. This disease impacts families because, on average, only 29% of EVD patients survive, so many would suffer the loss of a loved one. Ebola virus outbreaks, like any other disease outbreak, disrupt both trade and delivery due to restrictions on travel. A major example of this would be when in Sierra Leone, Liberia, and Guinea, All three countries lost roughly $2 billion of gross domestic product due to an Ebola pandemic. Due to an increased death rate because of the virus spreading, productivity then decreases. This means that healthcare systems struggle because resources are diverted to treat patients if infected with EVD, so people receive a reduced quality of care. This disease has an impact on communities because when small communities are hit with a sudden outbreak of a dangerous disease like Ebola, citizens are more likely to die from preventable diseases like the flu, because medical centres are trying to stop the spread of this single disease. Currently in Liberia, the National Institute of Allergy and Infectious Diseases has been running a program. This program is known as Prevail 4, and it is researching the ability to clear the Ebola virus RNA from the semen of Ebola survivors. Research for Ebola is really important because countries that cannot receive enough supplies or support the number of cases going on within their country will be able to treat patients when research is taken further into finding a cure for Ebola virus disease. The Global Ebola Response Coalition was a campaign created to support African regions to reach and remain at zero EVD cases. The key messages of this campaign include stopping the outbreak, treating the infected, ensuring essential services, preserving stability, and preventing further outbreaks. The media used to spread this awareness include Twitter, Facebook, YouTube, and Flickr. The target audience for this campaign is families and organisations willing to donate to the website and help with resources to send to struggling communities who are going through EVD pandemics. The effectiveness of this campaign is that the Ebola Response Coalition is still spreading awareness of EVD and supporting countries that are still enduring outbreaks of the disease to this day. Thanks for watching, and I hope you learnt something new about Ebola virus disease.